Okay, hello. I think we can kick things off now. My name is Dr. Alice Butler-Walk, and I'm a lecturer in sociology here at Robert Gordon University within the School of Applied Social Studies. I organise the school's community seminar series, and I'd like to welcome you all and thank you for coming along this evening. We're really glad that you could join us. Just a couple of housekeeping things to cover before we begin. For questions at the end of the talk, and I ask that if you have a question, you add it to the chat panel for me to feed to our speakers without us all having to navigate muting and unmuting and all of that kind of thing. And you can do that at the end or as we go along as questions come to you. This talk will be recorded and will be posted on the university's YouTube channel. And when it's up on the YouTube channel, I'll be sure to send an email out to let you know that it's there if you want to rewatch it or share it with your networks. Any questions that you ask them will be read out anonymously. So on to today. We're thrilled to welcome Dr. Leona Vaughn from the University of Liverpool in England and Dr. Allen Kiconco from the University of Witswatersrand in South Africa. Allen is a postdoctoral fellow based in the Department of Political Studies at Wits and is a leading international academic in the field of modern slavery, gender and conflict in East and West Africa. She comes from an economics, disaster management and African studies academic background. Her book, Gender, Conflict and Reintegration in Uganda, Abducted Girls Returning Women, will be published in June this year. Leona is a sociologist and qualified coach for senior professionals with over 20 years working as an equalities and social justice expert nationally and internationally. She researches and writes on risk, safeguarding, racialization, child labor, modern slavery, and childhood radicalization, and was recently the principal investigator on a rapid response research project on the racialization of risk narratives for COVID-19 prevention in Ghana, Kenya, and South Africa. She collaboratively designed this project with in-country academics and community researchers, which is what she and Allen will discuss today. So our speakers will present together, so I shall hand the microphone over now to both of you.
Good evening, everyone.
Hi, I think that's working.
Yeah, okay, yep. Allen, your microphone.
Hi, everybody. Sorry. Yeah, so as Alice has briefly introduced us, my name is Allen Kiconco. I am based in Johannesburg, where I work as a postdoctoral fellow at Wits University in the Department of Political Studies. And tonight I'll be sharing the research I've done with Dr. Leona Vaughn tonight. Leona, if you can say something about yourself.
Yes, my name's Leona. I'm a Derby Research Fellow at the University of Liverpool. My research focuses on anti-colonial methodologies. It's termed doing harm by doing good, to encompass all of the different research that I do. Yes, so Allen, would you like me to continue?
Yes, please.
Okay, so this presentation is on the colonial virus, COVID-19 and racialized risk narratives in South Africa, Ghana and Kenya. I'd just like to give you a little bit of a background to the research in terms of why we decided to do this research onto this particular subject. So this research was prompted by the early COVID-19 myth of Black immunity to the coronavirus. So I'm a sociologist, as Alice mentioned. So you would expect that I particularly noticed how race started to play a major part in how the coronavirus has been communicated, not only in media, but also within political narratives. And just to sort of explain a little bit more about what I mean by that, you know, the virus was from the very outset racialized as a Chinese problem. And this manifested in various ways, ranging from politicians blaming the virus on China, through to social media memes and jokes, to most worryingly, increased racist attacks on people perceived to be of Chinese or any Southeast Asian descent. But like I say, simultaneously to that racialization was another form of racialization at the early stages of the pandemic, in how certain communities were being referred to as either more susceptible to the virus or more resistant to it. So specifically, I was interested in the talk of Black, especially Black African people being immune to the virus. So where did this begin? It actually began within Chinese media. The story of a miraculous recovery by a Cameroonian student in China, which led to ideas of natural immunity being discussed, particularly in the media, but also within social media. So like this pop quote shows, "Our melanin is our defense." You can see that this idea had permeated down to social media users, particularly across the African continent. So the idea of Black people of African descent being unable to contract the virus permeated social media in this way, but also you saw it start to appear through memes, through jokes, and through various statements. So the idea was that Black people of African descent couldn't get the virus due to high levels of melanin, due to exposure to sunlight and heat, due to better diet, due to more natural innate strength. So Idris Elba, who I always like to quote when I can, Idris Elba is on the slide here. Idris Elba warned of believing in this so-called positive stereotype that Black people were immune to COVID-19. And he spoke to the media about this when he contracted the virus himself in March. But I think it's important as well to state here that these ideas around immunity have very worrying echoes of notions which justified the enslavement of Africans and the pseudoscientific racism which ensued from the 19th century to the present day. And as someone who was working at that time with researchers in countries across the African continent, I was particularly interested to see if or how the myth had affected how those Black majority countries thought about the risk of COVID-19 infection, if they believed their populations to be immune, or if the myth had even reached the politicians and publics of these nations. And in fact, the same month that Idris Elba spoke out about this conspiracy theory, the BBC News reality check team published an article called "Coronavirus: What Misinformation Has Spread in Africa." And this article cited the dismissals of this particular myth that Black skin was resistant to the virus from the Kenyan health minister and the South African professor Thumbi Ndungo of Durban School of Medicine. And as you can see here on the slide, there were some other South African academics who spoke out specifically against the myth. So that was the context, that was what was happening at that time. Like I say, I was working with colleagues across the African continent on various other research projects. But when this call for project ideas to undertake what the University of Liverpool called a rapid response research on COVID-19 for countries receiving official development assistance, I instantly reached out to some colleagues that I'd worked with before on issues of slavery and safeguarding to see if they were interested in collaborating. And I'll hand over to Allen, who was one of those people.
Thank you, Leona. I remember when you sent me the email suggesting this project, I remember so much was going on in South Africa regarding the issue of Black immunity. For example, people were debating the first case we had where it was a white person returning from Italy and his wife. So people were sort of like confirming what had emerged from China, that the case that Leona has hinted on. And then I also remember, like in my suburb where I stay, there were those debates among Africans. I went to a hair salon and people were not like really bothered about the pandemic because there was a sense that white people and the Chinese were more vulnerable to the virus. So when Leona sent me the email, I could make sense of, how we could collaborate on this research, because the issue of Black immunity was cutting across. People in Kenya were talking about it, in Uganda, back home, in my country in Uganda, people were talking about this issue. They were sort of like resisting people coming in the country. So she contacted me and I was able to like make sense of what we would do. And then also she was able to talk to me about the people that would be part of the project, the people she had collaborated with on previous projects. And then we ended up having a team of 4 I based in South Africa, Isabel based in Kenya, and then also two colleagues based in Ghana. Leona had worked with Isabel, had worked with the Collins and also Nee. So I was meeting them for the first time. So maybe to give you like some context on the team, Isabel is a senior media technician at Kibabi University. She's also a researcher collaborating on the community media for Kenya project between the University of Brighton and Rongo University. And they create sustainable initiatives with the local communities. And then Collins and Nee, who are based in Ghana. Collins is a theater director, researcher, and community development advocate. Then Nee is a researcher who uses arts-based methodologies to explore social issues. So Nee and Collins have worked together on different collaborative projects with universities, both local and international. So we were tasked to come together and think about the project from the start, when we were applying for funds, when we were talking about how to design it, how to go about it. So before everybody made a decision to be part of the project, we had that initial conversation. So the first thing we had to talk about was how do we go about doing a research in a pandemic? Leona, if you can go to the next slide, please. So between the end of May and the end of July 2020, when we had the first wave of the pandemic, we decided to start the project and do it remotely, gathering data on the risk narratives for preventing COVID-19 infections in these 3 countries. So all of us were under lockdown. I was in South Africa, far away from my family. So we're experiencing lockdown differently. Leona based in the UK, the other teams based in also different countries. So everybody was like seeing the pandemic unravel or evolve differently. So we did not know how the project would also develop along the way. So I remember the tensions that were going on. For my own case, I remember going through a number of emotions, being, a Ugandan in South Africa. There were other issues that were emerging concerning xenophobia. I was worried about accessing medical care. What if I end up getting infected? How do I go about this? Who takes care of me? So there was a lot going on. But then I remember thinking that being part of such a project where we are talking about the issues we are facing at the moment, being able to share with different people based in different countries, I saw it as something that would help me sort of cope during the lockdown. So we came up with a centralized way of working, and we had to rely on Dropbox. Because yes, we were worried about how do we go about storing data. We were all having like different capacities. I work with the academic institution. Leona does the same. The other colleagues, they work differently. So we had to think about how everybody can collect and store data. So external hard disks were bought by Leona, and then they were dispatched. My colleagues received, me, I never received. So we had to come up with an immediate, solution for such a situation. So we had to rely on Dropbox, meaning everybody on the team had to sort of access internet to be able to access the data. So we also decided to hold meetings, weekly meetings. We used to have meetings on Monday via Skype and later on Zoom, which helped maintain the momentum for the project because we understood that a lot was going on. Yes, but some of us were having like lots of deadlines. I was in the middle of writing my first book. So we're worried about being consumed by like other issues besides the project. So we had to like do it every week so that we present. Everybody had to come up with the emerging issues in the week they had observed, in the government responses, the government communications, in the communities. Everybody had to compile, like on a weekly basis, report to the team. And that was helpful because besides reporting on the project, on the findings on a weekly basis, we're able to share the challenges of going through a lockdown. I was all alone in my flat. I wasn't like meeting people because the police was on the street, weren't allowed to go anywhere. So for almost 3 weeks, I never left my place. But then for this research, somehow I looked towards Mondays. I remember I would look towards Mondays so that, my colleagues would ask me about how I was going about, being alone and all. So that helped for my case. And then also each member had an opportunity to present, to host the meeting. Now, the reason why we did that, I work with the collaborative projects, and there's a tendency that people take a backseat because there is somebody who is the principal investigator. There are, two scholars, academic scholars, so they know how the things run. So also sometimes people who think they have done this before, they tend to take the lead. So in this case, we did not want that to happen with the research. So we allowed everybody to host. So that, if it is your turn, you mobilize the team, you remind the team, you make sure you prepare because you're the first person to present to the team. So that helped for everybody to be on board and also take extra time to prepare so that everyone benefits from each round of the presentations. So the challenges were there. The main one was internet. In South Africa, I was slightly better off because I had a stable Wi-Fi, but my colleagues, they struggled a bit. Our colleague in Kenya, she struggled the most because she had to rely on mobile data, which sometimes can be expensive to hold a call on Skype for an hour or an hour and a half. So we had to be flexible. We had to understand that everybody was experiencing lockdown differently. People were moving up and down. People were in conditions where they could not hold a conversation in a silent place. So we had to be accommodative. Our colleagues in Ghana, they had to move from where they stay because they could not access network there, or they were worried about rains that would take off the electricity. They had to move to locations where they felt they could hold the conversation for that 1 hour, or the 2 hours we had for the meetings. So we had to be flexible. Some of us who are better off, we had to be aware that anything we can have disruption. So we have to sort of prepare for whatever happens. So data collection, mainly from social media, but also from government statements or policies, the TV, the radio. Then we also, something that personally I didn't expect, were the social, commentary aspects, because people on the African continent, there is a way we communicate. It is not always formal. People communicate through songs, people comment through, proverbs, people comment, in drama, through drama. So our colleagues in Kenya and Tanzania, they were able to bring that kind of content. That is something I had not, anticipated. And also me being in a country where I am sort of excluded from the majority of the Blacks in this country who stay sort of far away from the white-dominated slums. I was unable to access that kind of content. So it was good to see that my colleagues in Kenya and Ghana, they were seeing what was going on in the streets, in the neighborhood. People were singing, people were coming up with slogans that was sort of trying to communicate their feelings or their reflections on the events of the pandemic. And then also, we were able to complement these ways of collecting data by accessing the University of Liverpool. We were able to access materials that were being published officially Personally, I benefited from that a lot. I was able to like spend more time gathering data that had been days or months or days leading to the pandemic. So I was able to compare the situation like months before and then the current situation. And then also we worried, I think the main worry we had was the risk of fake news, fake information. We were worried about reporting information that, because there was a lot of information emerging from different sources. Sometimes the information flowing via WhatsApp was a lot. There was a lot of information. So as a team, we worried about how do we cross-check the data along the way. So everybody, different teams, we went about dealing with this, but then every time we would meet, we would have to question the data. We would ask who is saying this? The person, and I think later on we'll talk about that in the methodology, why we had to center the Africans to understand this content. And I think that was the strength of our project, so that people can explain why somebody is saying something, why somebody is responding in a specific way. Culture, sensitivity somehow in this project played a big aspect. So we will get into that later on. So one other thing that I would want to hint on that we systematically worked on as a team was we asked the question of how do we ensure accessibility of our content, of our information. Personally, I did not want us to wait until the end of the project so that we can disseminate our content, because I knew other people were doing research in the pandemic. Some people wanted information on how the pandemic was unraveling or developing in different parts of the continent. So I felt we could contribute to that. So we came up with a website where we were able to reflect on our experiences in the process of conducting the research. So everyone wrote blogs, and you could reflect on your own situation, how you're dealing or how you're seeing the situation, develop or unravel, and then also you link to the project. So initially we had planned that we would have one report. Okay, but besides the website, we also came up with the Twitter account, and then we had planned that we would have the main output as a report. But along the way, we collected a lot of data. And we felt as a team, that just writing one report would be condensing so much content in one report. So and then also it became clear along the way that, yeah, there were similarities in these experiences, in the emerging themes, but there were also differences. So we felt coming up with just one report, we would miss out some issues. So the team decided to have reports on specific countries. So I wrote a report on my content that focused on South Africa. Even my colleagues worked on the one on Ghana, and then in Kenya. And then we had a fourth report, which was like combining all the main themes, reflecting on the methods, reflecting on how we designed the research, how we went about doing it as a team. So that is something that we had not anticipated when the project started. So moving to methodological considerations. So the research funded by a UK university, the principal investigator is also UK based. We are focusing on 3 post-colonial countries. So we're worried about the issues concerning, or the problems concerning with coloniality in our collaborative research. And all of us, on a team, we've been part of collaborative projects. So we knew the issues that come with engaging with a number of people who come from different backgrounds. Yes, we may be Africans, the majority of the team, but we all have different mentalities. We've all experienced, coloniality, or we still experience it differently. Yes, I was born and raised in Uganda. Then I work in Sierra Leone. Now I am working also in South Africa. I went to my university in the UK. So I have like different layers of how I understand the world. So I was worried about me thinking that everybody should or can look at the world or experience the pandemic in a similar way. Also, Leona had issues about that. So as a team, we had to come up and decide on how to approach the research. We were worried mainly about the power imbalances mainly. So the first thing we did, it was to have that discussion, that open discussion. Yes, the power imbalances between who is best in the global north, who is best in the global south, how do we go about dealing with those tensions? And then also people who are in academia, people who are working, with the local communities as well. There are also those tensions. Now there are also those tensions of class or academic or economic privileges. Personally, I was worried about that because being an African, researching Africa, I experienced that a lot. I can see how my education privileges somehow determines the relationship I'm going to have with my fellow African. So I was keen on addressing that immediately after we got the funds, so to were able to know that we were doing this research, all of us as experts. So we had to think beyond just working on post-colonial contexts. As individuals, as a project, how would we want to treat each other? So I remember we had to think of how to relate with each other, how to communicate with each other. We had to ensure that people who are based in different capacities are able to reach out to the principal investigator, to me, who was a co-investigator as well. I was able to have this conversation with the principal investigator, who also understood like my own concerns about my colleagues the other side, and also they also had to express their concerns or their worries or their perceptions that they could have had about the project or the members of the project. So mainly we wanted to disrupt the colonial logic that places African research partners as data collectors.
Absolutely.
And then also disrupt the perception that Western-based scholars should interpret the collected data. This is something that we wanted to deal with at the start. So everybody knew that they could collect their own data. It was their lived experiences, and they had to interpret it for the rest of the team. So that is one thing that we had to address at the beginning. So we collected the data, we interpreted it in a manner that were foregrounding our experiences and our cultures. So now, Leona, I will let you continue, from there.
Thanks, Ellen. I think that it's important as well so what you've described there is really about us having a really very anti-colonial approach to our research practice. But it was equally important, like you say, to have an anti-colonial approach to the theory that we were using as well. So, I mean, in relation to coloniality, so much has been written about pedagogical and epistemic erasure of indigenous knowledges, Linda Tawai-Smith, Paulo Freire, Tamale, Spivak, etc. But in this project, we really wanted to actively acknowledge the shortcomings of using Western-centric theory to try and understand a phenomena that was happening within a global South context, so particularly within the context of the African continent. So, for example, we used Beck's frame of the risk society to analyse the communications on risk and COVID-19 within these three post-colonial countries, but we had to look at what the shortcomings were. And in the risk society thesis, Ulrich Beck asserts that risk affects people equally across the globe, All matters from environment to crime are viewed and attempted to be controlled through the lens of risk and uncertainty. And within that, he says that risk is therefore democratic. It doesn't discriminate in who it affects. It even affects the rich and the powerful. And Beck's work is one of the most influential academic theories of modernity and globalization. But I'm going to put a big but here for Beck, is that he very much minimized how the imagining and the categorization of risk are an exercise of power in this global society, especially in his claims that racism, sexism, and classism were no longer relevant to the risk society. He called them zombie categories. So no longer relevant in how the risk society is structured and it operates. But we know that global structural inequalities show that the attribution of the risk label and the perception of who is risky, especially when it's influenced by the state and or the economy, is likely to favour the behavioural and cultural norms of the powerful over those of the marginalised. And for that reason, you know, we very much approached risk and the risk society as a colonial project. And this chimes with others in their assessments of modernity and globalisation as both globalised and racialised phenomena, such as Mignolo, Hesse, Rutazibwa. So that leads me to the other theory that we utilised for this research, which is that of racialisation. So we were interested in how racialisation affected the risk prevention narratives, especially the myth of Black immunity. And therefore, we were interested in how race was made, how it was made in the public and political narratives, but from the perspective of Black majority countries. And what we found was that the lens for seeing racialisation in theory and literature regularly centres whiteness and the global north at the heart of its orientation. So as Jemima Pierre acknowledges, there's limited literature on the processes of racialisation from different African perspectives. You know, the contemporary literature on racialisation attempts to address the early theoretical and analytical knowledge gaps through, for example, considering racialisation beyond the Black and white boundary to considerations of ethnicisation, exploring racialisation in post-colonial racially stratified societies of Latin America. We found a lot of literature on that. We also found a lot of literature on analysing the processes of apartheid or post-apartheid South Africa. But we found there was still a glaring omission of racialisation studies which spoke to the multiple processes of racialisation in modern day Black majority countries, particularly those within the African continent, especially in a decolonial sense, or in the way in which Asante would say and describe it, in the Afrocentric sense of theorisation. So we knew that without this critical approach to theory, that we were at risk of a form of what Ndlovu Gachene calls epistemic arrogance. So epistemic arrogance, meaning that global understandings are developed of particular theories, in this case, the theories of racialisation and risk, which are not in fact very global at all. They're actually very Western oriented. And so we were really alive to that issue in our analysis of the data. So that describes our methodological approach, and we really feel that it's important to describe the methodological approach because that really very much determines the outcomes of this research. And through our data collection and analysis, we found that the myth of Black immunity had some influence on the public and political narratives across all the countries. Like Allen says, there's some difference. But what we saw was that there was support for the fiction, but there was also efforts to actively undermine this information. Now, the World Health Organization declared misinformation relating to the pandemic, which often circulated through social media, as an infodemic. And we would position that this myth in particular forms a part of that infodemic, even though it isn't explicitly addressed by WHO. And in exploring this immunity myth, we found a demonstration of something that was a much larger issue, much larger than our short research project, but it was really important to notice. And that was the fact that biological race, which is a myth in itself, was still widely believed in both political and public narratives. And so we found a video circulating with a it was like a documentary type video where they were interviewing people on the streets. And they interviewed this West African woman, and she referred to coronavirus as the colonial virus. Now, we can't know for certain what she meant by this, but in this context, we would address it as potentially having two meanings. Firstly, that it was seen as a virus that was being brought to Africa by previous colonial powers. Now, the virus was regularly referred to by states and people as being brought in by outsiders, foreigners, tourists, or travellers. And the first two terms often were used to signal other Africans or Chinese people, but the latter two terms, tourists and travellers, were used much more often to imply that white people were bringing the virus to the country. So I think the second interpretation is that the experience of the virus and the response to it was seen as an extension of colonialism and coloniality. So we used the term colonial virus to show this potential, and we entitled our report in the same vein. Because colonial thinking, we came to understand, was very much wrapped up in how people were being told to act and behave in ways which were very Eurocentric and gave privilege to white and wealthy people within the countries. But like I say, I think the most colonial aspect of our findings was that the colonial idea, this myth of race, which stems back to slavery and empire, was as strong now as it ever was. So our analysis of the public and political narratives identified four key themes. Firstly, that race was both hypervisible and invisibilized in narratives on coronavirus prevention and risk. Secondly, that risk responsibilisation for the importation and spread of the virus was very much highly racialized. Thirdly, that the colonial logics that I've just described very much shaped the pandemic policy responses in these post-colonial countries. And fourthly, that the racialized infodemic about Black immunity was often very much embraced and welcomed by local people. So Ellen and I will talk to these themes, but I think what I'd like to start off with is that it's important to note that our research took place in the early COVID period, before anyone knew any facts about coronavirus. And so to us, it was clear that in the absence of facts about COVID-19, that the states and the populations were trying to make sense of what was happening by creating their own facts. Whether they were actual facts or not is another discussion, but there was a certain element of filling the vacuum by local people. And that vacuum was filled with facts about what they thought and they imagined the risk to be, who or where they saw the source of this risk, and what actions they felt would help prevent the risk of infection. And all of these inevitably drew upon established racialized narratives around risk in relation to who was seen as the other. And so I split this into hypervisibility and invisibility. So the hypervisibility refers to the fact that race was highly visible in some narratives. COVID-19 was seen as a risk that the rest of the world was posing to Africa. There were frustrated calls from the public and others to their states to close the borders, and these were very much unchallenged, undisputed. There was a sense that this was an action that should be taken. But within that, we identified that there was, within these narratives, that Africans were seeing the virus as a foreign virus, a foreign disease, an exogenous threat, and a them virus, which was a very popular term actually within the South African narratives. And this othering was applied to those who were perceived to be the source of the risk bringing the virus to the country, but was also applied to Africans who were returning home from abroad or internal migrants who were seen as bringing the virus either back home or into the country. So like I say, the risk label was applied to all of those who were seen as outsiders, but the clearest stigmatization was of Chinese and African migrant communities who were excluded from help and support during the pandemic in all of the country's policies. So some of the things here on the slide, you can see that the white communities within South Africa were saying that white people were being excluded from aid. The quote there by Professor David Averett about, you know, it being seen as a disease of white globetrotters. But it very much filtered down to Black Africans as well within this. So the Twitter quote here is from a Twitter user in Kenya who is saying, you know, don't panic, it's white people who are affected. If it was a Black person, we'd know that their underwear size too. So don't worry about this. So like I say, the othering was very much in relation to those who were outsiders, but also it sometimes took the form of resisting and complying with self-othering or self-racialization. But Allen will come back to this topic later. So that was about race being hypervisible, but I think the invisibilizing race, which the Twitter user talks about there, about, you know, if they were Black people, we'd know all the details. This invisibilization or attempts to obscure race was really clear in some of the countries, and particularly within South Africa. But there was an element of sort of dog whistling, dog whistle politics in the use of certain terms. So like I talked about before, in terms of, you know, travelers, tourists, we knew that there was a racialization to this. And the establishment of the very important persons treatment centre in Ghana, which was targeted at diplomats and travellers, was very much seen within the public narrative to mean that this was a specialist preferential treatment for white people and rich Ghanaians. So it did happen in other countries, but specifically the data invisibilization was observed within the South African context. So the South African state reported on cases regularly, but they made no comment at all on whether people were South African, had travelled into South Africa, etc. Likely as a way to try and distance the preventative measures and pandemic policies from their apartheid history. But what we saw was that this invisibility caused tensions in public narratives, similar to the statement there from Kenya. So the other theme was about racialized risk responsibilisation. Now, responsibilisation, I'll just give a definition here, is a process wherein the government distances itself from traditional state functions and thereby liability for blame when they're not fulfilled. Now, there was definitely an interaction of misinformation in the narratives about who was responsible for the outbreak of the virus and how it was being spread, with the other myths such as Black immunity. And this fostered mistrust and resentment between communities. So we saw, you know, holding individuals responsible for state functions, i.e. to protect the health of the population. And that was often very racialized and classed in the narratives. So in the public COVID-19 narratives, government was a regular focus of criticism and blame for not stopping those who were seen to be responsible for the virus spreading. But how racialization and stigma manifested often related to the country-specific economic relations, both new and long-standing, with either other African countries, European nations, or with China. So at the same time, there was this element of risk responsibilisation that was levied at individual people or communities. And this quote here from the Kenyan MP, which, you know, said that the residents should be vigilant and stay away from the Chinese. If you see them, stone them, chase them, stay in their houses. Was obviously very clearly racialized in that way, but there was an additional level to this of some people being seen as incapable of following pandemic guidelines. So, for example, people within the suburbs were seen as, you know, capable to follow guidelines versus those who lived in more informal settings or slum dwelling. Those who were adults were seen as, you know, sort of following the rules, but young people were often stigmatized and responsibilized. But what was really interesting was that the nature of people's living and working spaces or their economic and social needs were not always considered in the public media or political narratives as part of making this adherence impossible. And that is what we talk about when we talk about colonial logic. So I'm going to hand over to Allen.
Thank you, Leona. I remember when there was like the the initial debate when we had our first case here in South Africa, Twitter went crazy. In that one side, specifically the Black South Africans, they were beginning to attack, their white counterparts, because it was like a confirmation that they were the spreaders, that they were systematically bringing the virus home. And of course, the public announcements from the government did not help matters, really. It was only later on when they systematically began addressing the misinformation here. So on social media, WhatsApp messages were cutting across, were receiving messages. If you're staying with the white people, you have to be extra cautious. So I began now observing closeness to white was a problem, not just in South Africa, even back home in my country. Every time I would hold a call, they would have this tone of you're in a country with more white people, we are worried about you. So it was like that misinformation, the myth that Africans, who are sort of safer, were not as vulnerable as the white people. But then also there was a sense that even if the virus gets to you, there's a way your immunity will fight it. So you can, rely on other issues or other, ways of dealing with it. So, and then also we saw the policies that the governments were coming up with as well. They were sort of targeting Black people in a way that was not, it was sort of like a bit brutal with the Africans. When we went into lockdown here in South Africa, we had the army on the street, and the police was specifically focusing on Black-dominated residences, keeping people indoors. And then also in the white suburb, I live in a white suburb, so it was a little bit flexible. I could leave the house. Later on, after maybe 3 weeks, I could leave the house and go to shopping centers. But for the Black Africans who sort of live away or live in different areas, it was very difficult. So there was that tension in that the Blacks felt the white people had brought the virus in their country. And again, the government was not directing its anger towards them. Instead, it was directing the brutality towards them. So there was like a lot of information emerging. And I remember it was a bit clear, like initially, the discussions I used to have with Africans, like in different parts of Africa who are based here, the discussion was different. The discussion was sort of, we should not be as worried, but again, we should just worry about us being or surviving the case in South Africa, not the virus, but surviving the, xenophobia. So for us, we are worried about the xenophobic attacks along the way. I remember the conversation I had with my Kenyan colleagues. They were saying if this virus was hitting on the Africans the way it is hitting the whites, we would worry about the stigma. We were thinking about the stigma that we had experienced as Africans because of Ebola, because of other issues that we have to encounter on a daily basis, racism. So we were thinking about the fact that it is, okay, people were sort of placing the argument that it is good, it's not starting from our side. We are not being affected in the same way. And I found that a bit problematic because it made Africans a bit relaxed, not paying attention to the policies, that internalized the racism rising up. So there was a lot going that we had to unpack in the project. And then also the racialized information also emerged indirectly about the immunity and vulnerability, and then also the prevention, the measures people were coming up with, the treatment, the cures. There was a discussion about the different people coming up with the different measures, and people sort of were not relying on them. They were sort of investing in them, and also the government was sort of relaxed on coming up with like clear messages on how people should go about dealing with that kind of information emerging from informal sections. So I remember having a discussion on this. People were not sure if we should follow the messages emerging from the church, messages emerging from local leaders, because the governments in most cases, they were unclear. So people worried about the information that was emerging. So I remember thinking, as we're working on this project, I remember thinking about the brutality that we're experiencing in different parts of the continent. We see that, as Leona mentioned earlier, we see that people were portioning risk to specific categories, and the youth. The policies were pushing people to stay in accommodations in environments that were not conducive. So we see the colonial logic emerging in the government policies, imported policies that were not relating with the reality on ground. So the individuals along the way, of course, as expected, people had to protest, had to break out. And then also on the other side, we see that people had to come up with measures to deal with the situation. So Leona, if you can go to the next slide, please. So the immunity case, inability to find the origin of the information, the absence of transparency and data sharing on the risk of coronavirus, which also caused trust issues. It left a void to be filled by other sources, which also made the project a bit difficult in this case, because the information was coming in from different channels. So we're not sure of how sort of hold back and cross-check with the kind of information, because my colleagues in Ghana, they got so much information like via WhatsApp. We were getting so much information from WhatsApp. I was relying so much on Facebook and Twitter. And then also in Kenya as well, my colleague Isabel was relying on Twitter and Facebook. So coming together with all that kind of information, sometimes it would be difficult to sort of decide if we should continue with this kind of data or we should hold on. Even at the moment, we still have content that we have to check to make sure that this is what it was supposed to mean when it came out. So the desire to believe in positive stereotypes also emerged in the data. People felt it is a virus affecting white people. It is time now sort of relax, laugh, and change the narrative here. We see people on Twitter, coming up with different slogans, different cartoons, different memes with the political figures here, trying sort of sit back, relax, and observe how the other world was also like taking a punch from for example, there were people but for them they interpreted it as, finally God is responding to our misery all these years. Now it is their turn, people who have been oppressing us, so it is their turn as well to face the rough. And all that, caused so much tension at the household level, social media as well, because at the end of the day, we get to see videos emerge, how people respond to all these issues. So in the findings, they explore something that we fail to get to is how the infodemic is also racialized. For example, the origins of these misinformations. Are they real Africans claiming this immunity, or is it coming from other sources, or other, people have read it, So we did not get to that understanding, the actual source of this misinformation. So it is maybe the research or the future research that could explore more of that. Yes, Africans were responding to it, but where is the source? So I will let Leona now summarize, the presentation.
Thanks, Allen. So in summary, the impact of the immunity myth on the lived experience of Black Africans across Africa and the diaspora is really unknown. You know, we did a critical discourse analysis. We looked at, you know, how it affected the discourse and the narratives, but we don't know what that meant for the lived experience. So we don't know whether, for example, it meant that people sought medical assistance too late, or, you know, didn't take precautions because they believed in this particular myth. So like I say, this was a 12-week research project. There was no way that we could have known about that. But I just wanted to flag it up that this is still something that is not empirically known. Like Allen said on the second bullet point there, we've got a lack of knowledge on racialized infodemics. We don't know their source. We don't know their motivation. And we're not IT experts, so there was no way we could try and trace this. But it's certainly a gap that needs to be addressed with future research, looking into the infodemic generally for the pandemic, but also the racialized aspects of it in terms of how that infodemic in particular impacted on the global south over the global north, or on people of African descent within the global north especially. So the third point in summary is that there is immense power in colonial epistemologies, and that power is still being played out today. And we say that because the belief that race is a legitimate category and an interpreter for biological difference was very clear in the COVID-19 risk and risk prevention narratives. And this, we talk on the last point, is about the essentialization of race. So essentializing race and race-based assumptions was something that we clearly saw within the narratives, and Hesse calls this ontocolonial. And he says that the modernity of social realities historically brought into racialized being by colonial regimes of demarcations, designations, and deployments. So we can see that the history is affecting the present in this sense. So like I say, the colonial virus could therefore be understood as the resurgence of the idea of biological race or eugenics during the pandemic, particularly with our focus being on these 3 African countries. But I would say that to some extent, this idea of immunity, which we looked at, is definitely creeping back through Western questions about why African countries have had lower death rates. But it's also having an impact here in the UK, and that, we did acknowledge that in our report as well. So, you know, the discussions about why Black and other racialised and minoritized groups are dying at a higher and faster rate in the UK and the USA often falls into this discourse, the discourse of pre-existing health conditions, the discourse of natural susceptibility or innate vulnerability. But what our short research does indicate is that we need to talk more, not less, about legacies of racism, institutionalized racism, systemic racism, and colonialism, not only across the African diaspora, but definitely at home. So we will end there. I'm just going to share some of the references that we have used in our research project. And also just refer you to our Twitter account and our website, like we say, where we shared all of our raw data, as well as blogs and reports.
Thank you so much. That was fascinating. And I think it was wonderful to hear about the actual process of the research as well. I think anybody doing research during this last year has faced some of the challenges of trying to work remotely, but I think it was wonderful to hear about how you actually negotiated those challenges. If people have questions and you want to start popping them in the chat box, that would be great. We already have one comment saying thank you so much for having conducted this very important research and sharing the insights. I suppose while questions are coming through, I suppose one question is, you mentioned at the end some of the things that we need to be looking at as we go forward. What do you think are the sort of next steps that we need to be thinking about and to be driving forward to kind of understand and contest some of the narratives that exist?
Allen, did you want to take this question, or are you okay with me just answering and then you can come in? I think that for our project in particular, we're interested in the impact on the lived experiences, especially. So, you know, a discourse analysis can tell you so much in terms of what people are talking about, what they're concerned about, what the state response is, you know, at a particular time. But like I said before, we don't know whether, going back to Idris Elba, sorry to go on about Idris Elba, but going back to Idris Elba, thinking about how that actually impacts on people's lives and death during this pandemic. So, you know, I think that obviously we couldn't do that within this period and within these, you know, sort of restrictions, but it would be good to understand that. But I think, you know, there are big questions as well about racialisation and understanding racialisation within the African context through the lens of African people. And we very rarely get to hear that perspective. It's usually either interpreted via a Western UK US lens, or it is very much sort of from the perspective of Black British or Black American experiences of racialisation. This idea around self-racialisation as well is something that is really interesting to us. Allen, did you want to add anything there about what you think the future could be for this type of research?
Yes. Along the way, there were like different information emerging, you know, debunking this myth. So it would be interesting to see if there was like change in the narrative along the way. That's what I would want to see. But then going back to what Leona is saying, you know, the impact on the lived experiences. And then in my experience, I want to compare, because for us, the research focused on like social media, what was emerging from the government and all that. Now there are other sources that you know, would be interesting to learn from them how people went about dealing with this. For example, the cases of rural areas and urban areas, because now the research, our research mainly, the data emerges from the youth, people who can access, you know, social media and all that. What about now people who are unable to use those mediums? So it would be interesting to see how people speak to this myth.
Thank you. And we've had one question that I think you've responded to already, Leona, about did you publish any papers based on your research?
So we published, as Allen mentioned, we published 4 reports, so to cover each individual country and a project report, but we're also just in the process now of, we've had a paper accepted for the New Diversities Journal about the process of racialisation during the time of COVID-19 in these countries. So yes, watch this space.
Brilliant. Okay, we've had a question here. Conducting research on COVID management in Africa, is it valuable to consider eugenicists through the perspective you proposed? I saw a lot of literature on African genetic peculiarity, but I would understand if this is, if it is valuable to consider it or not.
I couldn't speak to sort of medical journals. As a sociologist, I think it's interesting and frightening how much eugenics has had influence over the pandemic. And I would kind of put a warning sign over anything that tries to essentialize people's ethnicities into some sort of biological vulnerability or predisposition for any sort of virus. Allen, did you want to respond to that?
You remember, Leona, we had also that data emerging with Africans resisting, you know, like when the testing was beginning, people were sort of talking about why are they coming to like make tests on us and all that. And then we also had another group debating, you know, if we are not tested, how are we going to benefit from the vaccines along the way? Yeah, so I'm also like a bit hesitant. This is an area that I've not invested in, so I wouldn't like want to give sort of a solid or concrete answer to it.
I think that what we found most useful, particularly looking at what had been published in the UK and the US, was a more social analysis model rather than a biological model. So thinking about the impact of racism. So, for example, like the research from Geronimo around weathering and how racism actually reduces people's resistance to illness. I think looking at it through a more of a social perspective rather than a biological one would be useful. So we need to, we need to look at the impact, the way that Black people's lives are lived in the West compared to the South, and the different challenges that people face. I think is valuable and valid. But anything that would essentialize any sort of biological genetic predispositions, I'd be very, very wary of.
Thank you. We've got another question. Any thoughts about how discourse on social media unfolds organically rather than there being a moment of introduction of the idea? It's not unexpected that there would be some sense of celebration at what could be seen as retribution, and one such comment appreciated or, quote, liked spreads so exponentially.
So we saw a combination really of sort of this organic response, particularly with the Cameroonian students in China, but also there was an organised sort of hashtag China out of Africa type of response. So it was a combination really of sort of things just organically appearing as well as something that was more organised. But I think, as Allen mentioned, that the flood of social memes, of social media memes, sorry, on WhatsApp and Facebook around, Black people are resistant, last week, we were having our day. It's difficult to talk about how that occurs when you can't trace the source of the information. So I think probably you were talking, Alice, about future research, but somebody with more AI, big data type of knowledge would be able to look at that more forensically than we could.
Yeah, and then also just to add on, when we talk about like systematic, of course, you look at the three countries. In South Africa, I could say yes, somehow systematic, because this is like a daily conversation. We talk about race, racism, racialization. Life is, like highly racialized in South Africa. So it was sort of like a bit systematic when when I went to Twitter, I could see that people were drawing into those hashtags. And then when you look at the other countries as well, it was like a random, maybe somebody coming up to like react towards something, what had happened at the airport, maybe the experience engaging with the tourists and all that. So yeah, just to add on.
Thank you. Does anyone have any other questions that they would like to add, or anything that you would like to add, Allen or Leona, in the last minutes?
Yeah, I just noticed there was a question about the concept of hypervisibility and invisibility, and asking for us to elaborate a little bit more. So I think this actually just links to what Allen's just said, that hypervisibility of race, is that, it in a lot of ways in South Africa, in the South African narratives, it was everywhere, even when it wasn't explicit. So the hypervisibility was certainly there for all three countries, actually, particularly, like I say, when it was the idea that travellers or tourists were coming to the country and bringing this in. It was hypervisible. People were often in social media saying, white tourists are the only ones who can afford to go to Italy and return to South Africa. White people are the only ones who can afford to travel in, do international travel, and they're bringing it into the country. So there was that sort of a sense that race was everywhere, but the invisibility aspect of it as well was, sometimes consciously, like the South African case, where they weren't given any information at all through the coronavirus data about people's ethnicities or where people had traveled to or from. But also this attempt to sort of not talk about race as well, through the adoption of language that wasn't explicitly racial. So, like I said, with the Ghana situation, when they were talking about diplomats and travelers and VIP clients, it was inherently racialized rather than explicit. Okay. Ellen, did you want to say anything there? Because I think this dichotomy of hypervisible and invisible was really, really acute in the South African situation.
Yes, to add on, it is like also according to locations. If the location, for example, if you would tell somebody, I come from this location, like space, somehow it was also like racialized. You come from this space or this area, there's a question mark. Are you safe? Are you okay? And all that. And also the people is like seen as elites, people who have traveled abroad, who have come back home. I remember, for example, Malema here was sort of urging the government, whoever has been abroad in the last how many weeks leading to the pandemic, they should be held at Robben Island. So it was like a bit extreme. So somehow you would, when you're engaging with people, you would have to sort of hold back on some content, or some information that would identify you to being close to somebody who would be seen as somebody spreading the virus. So also the spaces were also like a bit racialized in this case.
I think that's a really interesting angle to kind of consider, that sort of the role of almost associative stigma, isn't it? Particularly around spaces and kind of reputation and all of these, which are obviously deeply imbued with kind of notions of coloniality and colonialism. So yeah, so much to discuss, and definitely looking forward to your paper when it comes out. I think that'll be really fascinating to read, and hopefully there'll be follow-up work to kind of examine some of these other questions as well. Because it's such an important topic to have been looking at, and also impressive to have produced so much and found so much out when some days it was a struggle to get out of bed, manage to shower and not eat the entire biscuit barrel. So I think that's brilliant. I think we can probably end there unless anyone has any other questions that they want to pop in the last minute or so. I'll just give people a chance in case they do have any burning questions to ask. If you're interested in future events as well, we have 2 more events coming up in the next few weeks. On the 25th of May, we have a talk from Dr. Philip Sargent from Open University, and he's going to be giving a talk on free speech in an age of technology-mediated communication. Then we have a session on the 1st of June from Dr. Gemma Holdy, How to End Burnout Culture in the AIDS Sector. So very different talks, but hopefully of interest. And if you are interested, just keep an eye out on our Eventbrite page, and details of those will go up shortly. If you want to be added to a mailing list, you can also just pop me my email address, pop me an email to my email address, which I'll put in the chat again, and I can make sure to add you to any details of events coming up as well. So I'll just pop that in there. But other than that, it just remains to say thank you so much to Allen and Leona for a fantastic presentation, and for everybody else for coming along as well and for giving up some of their Tuesday evening. Thank you so much.
Thank you for having us.
Thank you, everybody.